right, well, it's a couple minutes after 1 o'clock. I think we'll get started. Hi, everybody. I'm Luann Beninati from Let's Grow Kids, and I'm happy to welcome you here this afternoon for our regular conversation with the folks from the Vermont Department of Health and Doctors Brina Holmes and Becca Bell to talk about health issues in childcare. I just want to start this afternoon's conversation with a note about the fact that Let's Grow Kids has hosted these calls since it became apparent early in the COVID pandemic that the childcare community had a lot of questions and concerns that they needed some medical help and discussions around. And so we were so grateful to be able to connect with the health department folks and the doctors on the call to have a place where we could bring the early childhood field together with the medical experts to have conversations about health issues in childcare. As we moved out of the COVID pandemic, we realized those questions, there were health questions that still existed, and we have made a plan to continue these conversations on a regular basis so that the childcare community, the place where families often go first with their health questions and where so many health issues come up regularly, where they would have a chance to regularly connect with health experts. So as many of you know, Let's Grow Kids is moving into toward the sunset of our organization and focusing more and more on our policy work. And we're so happy that while that's happening, Vermont AEYC and First Children's Finance are taking over a lot of the technical assistance and coordination of supports and systems for the childcare world. So this is going to be the last call that Let's Grow Kids hosts in terms of the conversations between the childcare community and the healthcare community. We are excited to hand this, the facilitation and hosting of this over to Vermont AEYC and Beth Wallace, who's on top left of my boxes there, is going to be the Vermont AEYC person who coordinates these. So we've just been so pleased at Let's Grow Kids to be able to do this. We appreciate that you folks have shown up. There were a few times during COVID when we had hundreds of people on these calls with so many questions. So on that note, Rhea, who's been in the background, coordinating all the systems for this, making sure that we show up on these calls, and I are really happy to be here today and to hand this over to the folks at the Vermont Department of Health and Beth at Vermont AEYC. So Julia, I'm going to hand it right over to you.
Okay, great. Hi, everyone. My name is Julia Saracen. I'm an injury prevention specialist with the Family and Child Health Division at the Vermont Department of Health. I will be taking over from my colleague Katie Leffel, who's also on this call, as the Vermont Department of Health representative for these webinars. I'm also here with my colleagues from the University of Vermont Medical Center and University of Vermont Lugner College of Medicine, Dr. Becca Bell and Dr. Brina Holmes. Today, we're going to be focusing on level setting the transition. As Luann shared, these calls mainly started coming out of the COVID pandemic, talking about the constantly changing regulations and policies that childcare has had to maintain in a rapidly changing environment. Following the end-ish of the pandemic, we're going to be resetting back to focus on health and safety topics more generally. So today is really just going to be level setting about that, emphasizing that we will continue to focus on structural health and public health, and be very attentive towards your needs. And yeah, so I don't know if we want to focus on that, or I can move in to launching the survey.
Julie, do you want to go ahead and share your slide and talk about the survey? And then I know that these folks, we had one question submitted with some questions about allergies that I'm sure folks will want to ask the doctors about. And then also if folks on the call have questions that have come up in their mind that they want to bring forward, we can do that. It's a small enough group so that we can just use the chat box. If you have a question, put them in the chat, and maybe Julia, start with your slide with the survey on it and talk about what that will be, and then we'll go from there. Does that sound good?
Sounds great. Can everyone see the slide? Okay. So the Vermont Department of Health has received funding through the Preschool Development Grant to support health and safety needs in child cares. In order to provide the most useful resources, we would like to hear from you all about what health and safety supports you need. This survey can be completed collaboratively with leadership and staff in your child care. Also, my contact information is on the slide. Please feel free to reach out to me to discuss any specific training, information needs, or to answer questions about the survey more generally. The survey is launching today, May 9th, and closing Friday, June 6th. It's a relatively short survey that you can access through the link or the QR code. And our goal is to have this survey inform what we focus on in these webinars. So you'll be able to provide some feedback about what's working and what's not working, answer a variety of different health topics that you may or may not feel you need more additional support in, as well as identifying what modality you would like the training. So a webinar such as this, which is an educational offering, in person, I believe, is another option, and as well as online training opportunities. So this will be great. Please share this widely. Feel free to share on social media with other staff, other childcares you know in your region and around the state of Vermont. The more people that respond, the better, so we can understand exactly what we need to do to support you.
Julia, do you want to put that link in the chat too as well for folks? That might be an easy way for folks to grab it and to pass it on. And we can also get that out through Let's Grow Kids and I'm sure Vermont AYC. I think we've talked for so many years about the need for these conversations and the opportunity that these calls have offered. And I know, Brina, you've had so many thoughts for so many years about the healthcare community working with the childcare community. So this is an opportunity to really figure out how this could work, I think.
Yeah, that's right. I mean, and we're really hoping that we have folks that have been around a really long time and then folks who are new to this field, because the we need to recycle old ideas and we need to come up with some new ones as well. And I'm starting to find myself in that space of a lot of years. And there are things we used to do this connection between public health, clinical care, and our childcare professionals. We used to have different structures. So I'm so psyched that Julia has come on and is really interested in doing a public health approach, which is first we have to ask you before we decide what we think you need. So this matters a lot.
Exciting. All right, well, should we just, Julia, should we just dive in? I'm looking to you to lead us forward. Should we just dive in on some questions? And I wonder if a place to start is maybe with the Dr. Bell talking about what she's seeing. Often, Becca, you have great topics for us, knowing what you're seeing at the hospital level and with families, and that might spur some questions on the part of the folks on the call.
Yeah, sure. I'm happy to say a bit and answer any questions. So for everyone on the call, I'm Becca Bell and I work in the pediatric ICU at UVM Children's Hospital. So take care of kids, newborn up to age 18 who are critically ill or injured. And we're actually having a pretty good stretch right now. We're seeing like the typical smattering of things that we see. But in terms of patterns of illness, we're well past RSV season, which was really busy, but like it is before the pandemic this season. So remember 2 seasons ago, it was like really, really, really busy. This past season was about the same as we would see before the pandemic, which again was really busy. And what I would like to sort of forecast and preview for you all is further discussions as we head into the fall about what's available to help protect infants coming into the next RSV season. And there are sort of 2 options. There's a vaccine for pregnant people at a certain point in their pregnancy. And if they're going to have the baby heading into RSV season, they can get a vaccine for RSV, which is really exciting. or once infants are born in for their first RSV season, they can get a shot, which is a monoclonal antibody that helps protect them from RSV. So we didn't have a lot of it last year. Unfortunately, just the companies didn't make enough. So we had some people who were able to get it, and we have a lot of great hope that this will help decrease really serious illness. It's gonna keep kids out of the hospital. It's not gonna like prevent the number of colds you're seeing generally, but it's really to prevent those like infants. And I think about the kids that are the most at risk, the babies that are most at risk are the new babies that have siblings in childcare. So it's always like every baby I admit, it's like they're like 3 weeks old and their parents are like, how did they get this? And they're like, their 3-year-old sister's in childcare. So this is the perfect group to like for us to put our heads together to think about ways to talk to families about this exact scenario. So I'm excited to work with all of you on that. Typically, we've been seeing RSV season start around November, December. So we'll be talking more as we head into the fall about it, and especially once we know what the supply is going to be. So that's, I think that's really exciting for me. And then I just want to generally say that, you know, most of the kids that I take care of in the ICU, I mean, I said I go up to 18, but like the kids that get sick the most, you know, they get that viral illness and they have bad asthma, they get that viral illness, they get bronchiolitis. They're your age group. They're the kids that you all care for. So like the under 5 age group, they get sick a lot, and they can get really sick, and they end up with us. And then also a ton is happening in that age group around development. So you all are taking care of kids during like a really important, like a ton's happening around development. A ton is happening just around like general illness. And, you know, you don't have a lot of support. You don't have a nurse on site. And so, you know, Brina for a long time has been thinking about how to better connect the childcare space with local, you know, pediatricians and family docs that take care of kids. And we just want to like, I guess, put out there and recognize that you do a lot and you see a lot and you care for kids during a really important time. So just moving forward, as Julia said, we'd love to hear from you about how we can continue and to better support you.
I love when Becca's on because she describes herself as an ICU doctor, which is accurate, but she's so much more than that. She's really a public health leader in disguise. So don't be fooled by her. The fact she stands next to ventilators and it seems to always be in the most the sickest of sick. A few things that just bubbled up for me while Becca was talking, and then I'll go ahead and take the allergy question too, Luann, because so I'm Brina Holmes. I am a pediatrician, but I practiced in Middlebury for a long time in the 90s into 2000s. And then I spent this long stint at the health department, which is when I started hanging out most especially with Luann and all of you, and then have moved over to the Vermont Child Health Improvement Program, which is a really fun space because it's really where we try to look at community needs, think about children and families, and integrate that into the clinical care and vice versa. So Becca is correct. My number one passion here is that you have local champions in the child health arena that will show up for you. And there's a lot of depth to that sentence. I'd like the partnerships to exist in the context of just clinical care and one child and a family, but I'd also like for you to have partners and folks that you can reach out to when you need a little bit of support around what you're seeing or what you're experiencing with families. And I'm so glad to see Darla on. I don't know if other folks from Building Bright Futures are here, but hi, Darla. You know, there are a lot of different tables that are set in communities, and I don't pretend to know all of them, but I wonder about regional BBF as a place to find these connections. And then I also wonder, Luann and others, about the Starting Points network and if those still exist. During the pandemic, we had an opportunity to check in with smaller community teams of you, those were very rich conversations. And I bet Becca and I could find you a pediatrician in each community that would be willing to come to a meeting you already have, a Starting Points meeting or some sort of community structure to just talk about the shared experience of being a child in your community with a family. Because I get a lot of emotion when I talk to you, because I think we all know and need to say more to each other that families are really struggling, that there's a lot, there's the beautiful child, and then there's the whole ecosystem in which children are living, and that stress is on all of us. It's on families for sure, but it's really the people who care for children and families experience it too. So Becca and I have been doing what we're calling a roadshow, where we're trying to come to communities and talk to pediatricians and some community folks about, well, it's really just to relax and connect. And there's just a little bit of a level of despair. We don't like the term burnout, because it kind of implies that it's something on the individual, like, oh, you're burnt out, so you must not be doing enough yoga, or you're not eating better vegetables or something. And so we've stopped calling it burnout. We really just wonder how the impact of the pandemic on all of us and families, and then also how we want to support each other in the regrouping. So that's a lot of my hope, and folks, and Beth over at Vermont Association of the Education of Young Children, that team also, we just really want to help you. So if you write an email to Beth and say, we don't have child health professionals in this town that will partner with us, we will find you one. Because we really have found champions throughout, and it might take a little time, and we might have to think that through, but it doesn't have to be the person who's necessarily doing the medical care for the kids in your practice. I mean, in your centers or your homes, right? It can be just a relational space. So
Brina, I
that
just
said,
wanted, before
yeah,
you
go ahead,
dive
Luann.
into the next part, I just want to put in a plug for the Starting Points networks are now called the Vermont Early Childhood Networks, and Vermont AYC oversees them. So Beth is your
There it is.
connection there as well. So, and I see that Mariah, who's on, put her individual network information in the chat, but Vermont AYC is managing the networks, and they will be your way in. So that's really exciting to be able to make that connection.
Oh, I love it. So Beth, maybe if you just had a grid of the 10, now I forget what WECC, what your early childhood network, where they are, and maybe a point of contact. I think Becca and I could do a crosswalk for you and just wonder about this, because I think we're doing the same thing with schools. There was a lot of tight connection during COVID about, like, a school nurse really had to call a pediatrician and say, okay, what are we doing about X, Y, or Z? And we're trying hard to secure that bridge that established and was stronger during COVID. It's starting to fade again. We're such a funny society, right? We've already kind of gone back to our, what we say in my job is, when we get a little pinched as a human, we put our head down instead of up. And so this space of lifting our heads up and saying, I don't have to do this alone, is actually just a little extra effort. And so we want to really scaffold that for you and help. Okay. Time to talk allergies.
Brina, I think Beth was going to say something. Yeah.
I just wanted to say this is, perfect timing, Brina and Becca, because the early childhood networks are kind of going through a refresh as they are welcomed underneath that Vermont AYC umbrella. And so coming soon, regions are proposing their networks right now. We will have an interactive map that, as you hover over an AHS district, it will show you where the networks are and who the points of contacts are for that. But in the meantime, I'm already kind of shooting off emails to our resource and networks manager to make sure that we make that connection. Thanks so much.
Yeah, I love when that works. It's funny because I never knew what starting points meant. So it's good that you're rebranding. It's like, it's a starting point. I'd go to that meeting. Sure, it's a starting point. Okay, here's the thing about allergy. If I was on Jeopardy and somebody asked me, what's the number one thing you learned in COVID? Well, maybe I shouldn't be so hyperbolic. You guys all taught me something that I have carried for this whole 4 years. You taught me that just because a kid looks okay in a medical setting, or we are no longer worried that the child is contagious for something, they may not be able to function well in an 8-hour day in the care that you're providing in a group setting or even in a smaller setting with a couple of kids. So that energy level and the ability to participate and learn in your settings is the key about this allergy versus viral illness versus, with the umbrella of who can be where and what should we do about it. So obviously when a kid's nose starts to run, it's we have to do a broader assessment, which really you don't have to do, but you can certainly wonder, how's the energy? Is this child functioning? And can he participate? And it's always the absence of fever, right? So if you start with that, children with runny noses and itchy eyes that don't act ill and that have fun and run about are, I think, fine to participate. And they're in the absence of fever or not feeling well, it's not a contagious situation. But the first few days of it are hard. You're obviously in it right now. Here come the buds. I'm having all sorts of things myself, scratchy throat. But I do think it's a great opportunity for understanding family stress, wondering if this is a new experience for a child or if they do this every May, and trying to, and I'm so glad to see Peg on because she was part of our Touchpoints training recently. So in Touchpoints, we talk about coming alongside a parent's experience and first asking them what they think. What do you think's going on with Johnny's nose today? We noticed he wiped his nose 62 times. Because then parents can say, we all have allergies. He does this every May. Instead of that fear-based thing that goes on with parents where when someone's coming toward them, they think, oh no, we're going to get excluded today and I don't have any options with my employment. So, that it's just the energy field around it that's so hard, not the facts. So if it's a new set of symptoms and the kid's acting crummy, lying on the floor, moaning and not participating, he needs evaluation because either it's new allergy that needs treatment, which we've got some pretty good over the counter, but there's, also there's a lot going on with age with allergy. You don't want to just throw antihistamines at the littlest. You have to be very careful about that. So you do need a medical person for a new onset of what may or may not be allergy symptoms. But if it's a recurrence and the energy's fine, you're good to go. But because it's a small group today, you guys, we can, unmute and give me more scenario and we can do some real-time stuff here because it's pretty subjective what I just said, right? It puts you right back in that seat that we don't really want you to have to be in, which is medical assessment. And yet so much of what you do is that. But, start that day with, that's right, I know best if a kid can participate. And it's amazing how 15 minutes in an office can fool you. The kid's running around, he looks great, and you write the note. Remember all the notes? This child is fine for childcare. And that's why you need a trusted relationship between you and those providers so that someone can say, hey, there's something, it's very different for this child to be here 8 hours and we can't care for him individually lying on the floor when we have 10 other kids who are out in the playground, that kind of thing. Okay, I'm seeing, this is so good, Luann. We used to not have chat. We used to have like a webinar thing where I couldn't see the things. Okay. Health questions you might have. So Emily wants to know, I'm hoping you could talk about the best practice and policies regarding food allergy. Oh gosh, I would have to go back into my archives on that one. Well, you guys need to tell me more. So when a child is identified as having a food allergy, what paperwork do you receive from parents? I know what happens in school settings, but I don't want to assume.
Emily, do you want to just unmute and talk this through?
I don't see Emily because it's Julie. Is she one of the
Emily.
Julias? Oh, there she is. I
There
thought
she
she was
is.
one of the Julias.
I'm in the process of opening a center, and I'm talking more about younger children that don't have identified food allergies yet. And thinking about that first year when we're introducing a lot of our allergens, and hopefully parents are doing that at home, not in the center for the first time, that they're exposing them to some of the major allergens. But what kind of policies or recommendations you would recommend for like the infant classrooms regarding highly sensitive foods that children may have allergies towards, but we don't know yet?
Okay, I'm gonna have to get back to you. This is, as you just heard from the Brina bio, it's been a minute here. But Emily, I'm gonna say something interesting, and then Becca's gonna back me up. That general field of, we used to have a lot of rules about what to introduce with children. We definitely have maintained the belief that solid food should not start till 6 months, but beyond that, my sense is it's all loosened up a bit in terms of our understanding of how children react. I'm thinking of a few examples, but we've got the American Academy of, oh, there it is. Who just put that in? Awesome, Becca. Oh yeah, so the health, Emily, we should get you, and wherever, I meant to say this at the beginning, maybe Julia did, and so the health department has a district office in every one of your communities, and within that district office, there's a family and child health nurse who knows everything. So if Emily, if you tell me where you live, I'll tell you who yours is. Julia can as well. That person has healthy caring for our children, which is a child care pediatric guide from the American Academy of Pediatrics. And then Becca is pointing out the healthychildren.org free resource to all humans has lots of pages about that. So thanks for the link there.
Thank you. I was looking more for like the resources that I need to have to go about
Awesome.
planning policies around that.
Yeah, I'm going to put the link in too for the book. The district offices have them. I wish we could give them to all of you. Maybe Julia will find us a resource, because caring for our children is the health and safety guide for early care and education. Is that familiar to people? Looks like it's in a new edition here.
Everyone has access to Caring for Our Children on the Shared Services website. Every one of you who has access, First Children's Finance manages the Shared Services website, and you all have Caring for Our Children access to that.
Amazing. Okay, well then don't use the link. I don't know why it came up as the National Resource Center. Yeah, but that's but what's fun about it is if you had a pediatric partner and a relationship in your community, in case you get, because obviously you can set your standards, but then a family may have some other interpretation or view on this. Oh, hi, Jess. Hey, if I think you know everything, I think you should stick with that. That's terrific. I'm glad you're on. So that's it's the interpretation of some of these resources that I think you all see has a little bit of nuance. And parents, there's a lot of communication challenges between what parents hear, what they believe, what their medical professional says, and then what you know to be true. It's a bit of a jigsaw puzzle. And just because we're so proud of standards and healthychildren.org, and it doesn't mean that our medical colleagues are fully aware or implementing quite like that. So the advice sort of flies around. But starting with that, Emily, is great. And then we'll see and then call Jess if you're in Burlington. Peg wants to know about a question about background bias anxiety that staff and teachers may have about illness and the reality of the prevalence in early care. That's a big one.
I can.
Yes, say more, Peg.
Yeah, I mean, obviously, I think COVID, of course, made this exacerbated, but so I feel like it's not as extreme as it might have been 2 years ago, but I still think it is a thing where, I mean, you look at different individuals, and there's some families, the first sign of an illness, they're going to the doctor, and others are, oh, we're just going to ride it out. We know that viruses can, take care of themselves. So everybody comes to the table with a little bit of a different nuance and background about how they feel about illness and how nervous it might make them. And I guess I notice in my role as supporting teachers that that anxiety piece can really have more of an impact on conversations with families, you know, just a discomfort, comments like they're just sick all the time. Like it's just such a terrible, horrible, catastrophic thing. And so I just wonder how to kind of continue to normalize what you just said earlier, Brina, about how, or maybe it was Becca who said, it's just, it happened. Kids are going to be sick a lot, and to just
Yeah.
expect that. And it's not like this horrible, terrible thing where the families are doing something wrong, possibly, which sometimes feels like it creeps in too.
Oh, it sure does.
Yeah.
Well,
I
I'll
can,
I'll give you,
yeah.
yeah, go Becca, and then we'll talk about a little bit, Peg, about touch points after, because I think how we could use touch points in this space, but go ahead, Beck.
Maybe it was a year ago, and I'm happy maybe heading into the fall to re-show some of these slides, but I found this great study where researchers swabbed the noses of people, and it was like every week, I think it was. And
Yes.
so and they looked at households with kids, so adults with no kids and households with kids and then multiple kids. And so and the households with more kids, the younger kids, had like everyone had more viruses in their nose, and it's like a different virus, every couple weeks, to the point where like in households with a lot of kids, basically somebody in the house had something in their nose like every week of the year or something,
I remember you
and
shared that.
yeah, and some of it's not symptomatic, some of it is symptomatic. I do, but we know that this happens. So I think that it is true. I think people can feel it in different ways. Like one is as someone who's in contact with just this is the age group where they get these viruses. They're not as good at like containing it in the way adults are in terms of like wiping their nose and covering their cough. And so and I think COVID did make people feel really vulnerable to things like, to getting sick. I also think that sometimes there's a funny thing that was a problem before COVID and became worse after COVID, where like people like to make comments about the immune system that are not really accurate, right? Like, and parents will do this too. They're like, they're sick all the time. Something's wrong with their immune system. And it's like, it's like this month it's rhinovirus, next month is metapneumovirus, next month it's paraflu, next month it's RSV. It's just like all these viruses come around every single year. And when kids are getting it for the first or second time, they get a little bit sicker than we do when we get it, but we also get these things every year. So I think trying to not make offhanded comments about immune systems, I think is a helpful thing, because it doesn't mean, that's really not how these things work, like actual like immune problems that look very different than just having like frequent colds. That being said, some kids will start to develop, you'll see signs of, if they're a kid that's going to have asthma, there's like the kid who, when they get the cold, they cough and they wheeze and they're short of breath and they can't play. And like every time they get a cold, they get sick from that standpoint. That's a different thing, right? That's not like that's like, every time they get rhinovirus and then they're like really wheezing and short of breath. That's something that you want to draw attention to. And they would want to see somebody for that. But just like the frequent, like, it just seems like they have a runny nose all the time. That's like kind of what we expect in this age group. And we do know that kids who are in childcare, compared to kids who don't, like, say they don't go to childcare and then they kind of start school, like those kids who start school, like they get a lot of viruses when they start school too. So it's sort of like a delayed thing. And they, like you have 10 different discrete illnesses a year, when you're young and when you're in childcare, and it's a little less if you're not in childcare, but then once you go to school, you catch up and you get it all too. So I don't know, I'm glad you asked this, Peg, because I think it's an important question, and we're always trying to think about how to support families to have a healthy environment, but also to have realistic expectations around like what, sort of what's normal. I think a big problem was so for COVID, we actually didn't see a lot of those viruses, right? Like we didn't have RSV for like 2 years. We didn't have flu for 2 years. Kids weren't getting sick. So if you're a parent and you have a child born during COVID, and then, after we started opening things up, and then RSV came back and flu came back, and then the parents are like, oh, something's wrong with them. They've never been sick and now they're sick all the time, right? So but it's sort of, again, the patterns that we're seeing really are reflective of what we see before the pandemic. So it is, I mean, this is what I was saying. It's a tough age. I mean, this is the age they get sick like
This is
every
tough.
month.
Yeah.
It's so hard. It's so hard.
I wish we just
Yeah.
recorded what Becca just said. So now I'm going to go philosophical on you all, because here's what I would do. If you're in some sort of setting with the other adults who do the care, and somebody makes an offhand comment like this, I would want to know more about the adult's experience. So Peg, this is the touch points thing. So what we learned during COVID, especially when we would go to starting points and talk individually to childcare providers, school personnel, people get their information from a lot of different sources, and public health and medical professionals was just one of them. So the logic behind a person's comment. So if a person's frightened as a childcare provider about the frequency with which the children in her care or his care are ill, assuming that they just need it normalized is one path. We do that a lot. We're like, we'll just tell you the facts on this. There's 10 illnesses a year. Kid's going to be sick a lot. But if we do some touch points work on this and wonder what the person is really saying, we often found that the person had a chronically ill partner, a person that had experienced what seemed to be a minor illness and someone got quite sick, and there's just a lot of, in touch points, they call it ghosts in the nursery. It means that there's an ecosystem in which a person is coming up with a perspective that's hard to balance with a medical professional just saying this is normal. That's my experience. And what they taught us in pediatric healthcare is when a new family comes into the office, and you can do this with a new employee or an old employee or someone you've known a long time, ask them to describe who they're getting advice from. Because when a new family comes in the office and a pediatrician's like, you got to do this and this and this and this, and the parent kind of looks at you like, maybe. That's because the parent's sister is a neurologist, the brother, reads a lot of articles about nutrition, the next door neighbor is a chiropractor. I mean, I'm not joking. This is the world in which, not to mention I'm not going to do the internet, because I don't know enough to say about that. I just know that input is what is so helpful. So if you sit with someone that's worried about the care of children when they're sick, you'll find out more about why. Then you'll be able to figure out what the pathway is to bringing a little bit of reassurance. And that was so, remember in COVID, it was just so scary because people had parents at home or a spouse. Sometimes on our webinars, the spouses would be there because, anyone can be in the background, and there would be a husband that you could see was on oxygen, or you could see was, somewhat agitated by what we were talking about because they themselves they were taking chronic steroids on prednisone. There's just a lot. So I just really know we're all experiencing a ton every day, all day. And when I slow down and ask a few questions, I find out so much more about where to go with the conversation. But yes, everything Becca said is also amazingly helpful. And then if you know all that and a childcare provider in your circle is still saying, those people must not wash their hands, that kid's sick all the time, you might say, I wonder what it's like for that parent. Let's develop a strategy. How do we want to talk to them about that? Or maybe we'll talk to all of our families about something and hope that some of the, infectious disease protocols will rub off. I do that. I had a patient, I can see this like it was yesterday, with impetigo, and it lasted for 2.5 years. Because impetigo is, we have staph and strep as bacteria all over our skin, but when you get a disruption in the skin, like a little pick spot, the bacteria go in and they set up a little shop and make a little crust, and that's impetigo. So if you keep picking, you're going to keep having, so there's it's very hard to go to childcare with impetigo. I'm sure you have that on your list of things to So that was a long answer, Peg, which you knew you were going to get because you know me.
That's okay. I am curious about that chart. I don't, is that available anywhere around like how often a virus is inside a child's nose?
I can get that for you. Yeah, let me. I made a slide of it, and I have a link to the original study. So let me email it to. I'll email it to Julia. Does that make sense, Julia? And then you can get it to Peg. Okay.
Thank you.
Yeah. Brina, did you see the question about, there's Becca Webb has a question about vision and hearing screening.
Oh gosh. Hi, Becca. Okay, what programs exist for? So are you wondering how to get the screen done or what to do if the screen is positive?
I would love, it's so nice to see everybody.
I know. Hi, Beck.
Speaking of Egypt, I would love to have a flyer that I can send people to, like community programs, right? So often the school nurse does it even for our pre-Ks. But I often get questions from community programs about where they can send their kids to get screened, especially with the like how hard it is to get a pediatrician appointment and are they the right person and how much time does that, right? Like all of those other factors. It'd be great if that resource existed.
Well, it's so interesting you said that because, of course, the bias here. So vision and hearing screening is part of the required health supervision of children in our pediatric medical homes. And we go even further in Vermont, which is if you're a Medicaid provider in the state of Vermont, you have to do hearing and vision screening at the recommended intervals that are listed out in the Bright Futures guideline for the care of children. That said, what I'd rather work on, Becca, so I really would like the screening done in the medical setting for a variety of reasons. That said, if your community is experiencing a lack of access, then that's a real public health thing that Julia needs to, and Brina and Becca need to know about. Because we tell ourselves that we have the best health access in the country. So if it's not true, and the reason we say that is we're the only state in the country where all the pediatricians take Medicaid. So there's no payer barrier. And we also cover kids in Vermont up to 312% of the federal poverty level, which is it used to be the best coverage in the country. It's not anymore. Bummer. So health insurance shouldn't be a barrier. So help me with a world in which a kid wouldn't have a medical home, and then I will figure out if there's a alternative route for vision and hearing. What you might be describing is a timeliness that you would rather the screen be now and someone saying we'll see you in a couple of months, but
I
yeah.
hear things like struggles to have parents get to the pediatrician.
Okay.
I also hear, I think what I hear most is maybe it's this connectedness that as an early ed program, right? We're like in this health surveillance mode. And so maybe it's this communication of, hey, did you know that this is part of the regular health screenings, right? Like if the early ed provider doesn't have children who are of those current ages, they may not be up on that. So I think it's both a communication piece, a timeliness piece, and how do I get the parent the transportation access appointment piece, right? More than like, oh, it's months down the road.
Okay, well, let me think about that. I mean, maybe it is a nice opportunity. There is a project going on at VCHIP right now about making sure that everyone knows what their, high quality comprehensive child healthcare looks like in terms of hearing and vision and immunization and development. So let me think about what exists. And then let me double back to Becca there is the newborn hearing outreach program at the health department is a federally funded, making sure every kid gets a hearing screen at birth. Remember that? We used to have like the little bunny ears, and what was that program called? HOP. Remember HOP?
I remember HOP. I've been around.
Oh my goodness. Ooh, now I for the first time ever, I understand now why it was called, we had the bunny ears because of HOP. So I'm going to.
I see Darla has her hand up and she's probably gonna, there are several programs that like have this funding, but I would love to see a comprehensive list versus just getting visited by them at my BBF meetings and told all about their programs.
Oh, okay.
No, I
Darla.
just wanted to say that in the last couple of years through the grant that the BBF, the VECF grant, the Vermont Early Childhood Fund, there have been a couple of regions that have applied for and received funding to get hearing equipment. And so it's like through CIS programs, Children's Integrated Services. And I can tell you in the Bennington region, that's Jenny Moon. And I know, Brina, you said you'd rather have it done at the medical home. She then connects them with their medical provider if they haven't had an opportunity to have that screening already.
Yep.
So so there is a tight connection there, but I just did want to note that too, that Nancy can probably talk about it too. She's taken advantage of Jenny.
Oh yeah, we know about Jenny. Lucky
Good.
you.
And that's also for early intervention. So that's even the under 3. And then we're really fortunate because the Lions Club in Bennington does hearing for all areas. They, run a time when you can sign up and they'll come right to the centers and stuff to do, and they'll do a lot of rechecks. And again, and then those recommendations, if they see something that it's recommended that you go back to your physician and, do a recheck and have conversations with them.
That's awesome. This is gonna be a little project for me with Julia when we get off to get you sort of a comprehensive look at this. The Bennington situation is very unusual. Jenny's capacity for this is terrific. So in the past, to try to get early intervention teams in this space was harder, but I know in your community it works great. I did want to call out, this is so great. The regional dinners we were describing, there've been 4. There are 4 more. There's one tonight in Bennington, Nancy. It's at the Reluctant Panther. Yum. Becca's getting in the car in like 4 minutes to drive down there. We have Newport left, Brattleboro, St. Albans. That's it. We already did all the others. But we put the link in. If you're from one of those regions, we'd love to see you. It's free. It's been very fun, but also, important to see when people are asked what's going on in the world, they all say children's mental health. Oh, thanks, Adam. Are you able to go two or 3 things up in the chat where the link is, or we can also get it to you a different way? Hey, email me. I like your email. Hey, email me at gmail.com. Beck. Adam wants to come to the Newport dinner. But then Julia was being helpful when she heard me mention it and put something different in, but I am interested. This is so cool. I did not know that the National AAP was describing what we had done a few years back. So I feel like some of you may recall, we've done 3 of these roadshows in my tenure in Vermont. In 2008, we did these when CIS was launching. I'm the historian on the group. And the cool part about that was, it was the 3rd edition of Bright Futures, which is our health supervision guideline. And it recommended in 2008 that pediatricians do developmental screening with a validated tool. Prior to that, as you may recall, developmental screening was more the Denver developmental screen, or there was a lot of surveillance, but the actual validated tool screen launched in 2008, which led to these dinners. And we hung out and talked to CIS and had a ball. And then in 2017, we did it because the 4th edition of Bright Futures came out and said, hey, pediatrician, every checkup, ask families about food, housing, violence, substance use, mental health challenges, and your childcare situation. And the pediatrician said, oh, okay, we know that's important. What do you want us to do with everything we're going to find out? And the answer was, you need community partners. So we're really we're standing on the shoulders of all of that. And these dinners have been much more about hearing from communities and wondering how we can help as a American Academy of Pediatrics. And we'd love to see you there if you live in Brattleboro, Newport, St. Albans, or if you don't, and you just want to drive for free dinner. Okay, what else am I missing?
We have a few more minutes left. Is there another question on someone's minds?
I will just say
Yeah.
thank you for your attention to the hearing and vision stuff. And I will say my son, who's now 8, had to start wearing glasses when he was like 2. And guess who noticed the problem? Not his pediatrician mom. his early childcare provider, alerted us
See?
to the issue. Yep. So great. It was great communication. I
Okay,
was like,
that's
I think it's
amazing.
fine. They're like, no, something's wrong with his eye. Yeah.
I love that story. And he's doing great. Okay, well, Becca, we have some well, the other Becca, two Beccas, Becca Webb, we have some homework to get you what you need. We also want to see how we can make local connections to your early childhood. What is it called again? It's Starting
Network.
Point.
Vermont Early Childhood
Network.
Networks, just
Got
networks,
it.
yep. And Beth, Wallace, I wondered if you want to, before we run out of time, do you want to talk about what you and Julia will be doing for next steps in terms of these calls? And you might not have it all figured out at this point, but just to give this group an idea of what might happen next in terms of these regular calls.
Yeah, so big shoes to fill, Luann, and I remember being a participant in the early days of those calls during COVID, and just the sense of, you know, stability and reassurance that they provided early childhood educators. So thank you. So glad to be kind of on the other side of those now. Julie and I will be in touch. What we're looking at for schedule immediately is to host these every other month, and we'll try that out for a while and see if that makes sense, whether it makes sense to go back to seasonal. But that does mean that our next call is scheduled for July 11th, same time, and those notices will come out from Vermont AUIC. So look for those around the third week of June to sign up for the next meeting. And as always, please share with your networks, submit questions ahead of time. That gives us time to share with our partners and do a little research if we know that there's a hot topic to discuss.
And I predict in July, we talk about hand, foot, and mouth. The enteroviruses are coming. Can you hear them? Here they come. And they cause very high fever with no symptoms. And then when the fever goes away, the rash evolves. So it's a complicated, remember, and then you're all confused about contagion, except by the time the rash comes, it's not really that concerning. It was the high fever that produced the viral load. So there, I'm previewing this and pretending it's summer.
Get ready.
See you in July.
Julia, did you have any last, you want to prompt the survey responses here while we've got an audience?
Yeah, so in the meantime, please fill out those surveys, share them widely, share them with your fellow colleagues around the state, and please don't wait till the next webinar to reach out if you have any questions. I put my email in the chat. It should also be shared on that slide, which will go out to you all. Yeah, I'm looking forward to continuing to work with all of you and support you. This is a great discussion. So I'm really excited to continue to bolster public health and our early child cares and support all the amazing work that you all have done.
Thanks, everybody. This has been a great conversation. Have a nice afternoon. The sun's out here in Chittenden County, so maybe it's out where you are too. So enjoy your afternoon, and we'll see you in a couple months.
Thank you.
Thank you all. Thank you, Luann.